One of Ministries of Health's most important tasks is to elaborate norms to guarantee the best quality attention. These norms are disseminated throughout the health centers as documents or guidelines, as a reminder of the assessments that must be performed during the provision of health care of quality. The perinatal clinical history is a brief summary of those norms. It preserves the most important recommendations and highlights unusual situations. Its correct use guarantees that mother and newborn are receiving an attention of quality. During her first visit to a health center, the mother received the perinatal card, which is a copy of the perinatal clinical history, and all her data, medical background, exams, and controls are written in both documents during the pregnancy, from the first appointment at the first level of attention until the moment of delivery. The PCH is also a standard recollection of data and info completed during the whole pregnancy, creating a common language for everyone involved in this process, regardless the location in which the data was generated. At the beginning of delivery, the mother will go to the maternity with the card containing all information needed and relevant to allow an appropriate evaluation of her situation. The information in her card will be also transcribed into a new perinatal clinical history created at that moment. This is a very important step because during this process, for several reasons, this information could be wrongly transcribed and very relevant data could get lost. From this moment on, after delivery, mother and newborn are discharged, and their history is introduced to the software that creates a database, which can be analyzed by the institution, allowing the characterization of the assisted population, verifying the regulatory or recommendation compliance, and evaluating results and impacts. The database then is sent to the Ministry of Health via email or using a USB memory, and is consolidated in a unique national base. This method of transferring information at a central level is slow and secure, complicated, and it doesn't allow the access to the information in real time in order to elaborate analysis of events, evaluation of programs, strategies and plans, quite often causing the loss of opportunities for appropriate diagnosis, decision and intervention. The new SIP+ Perinatal Information System, SIP, had been designed with the highest security standards, making possible thanks to an ever-growing availability of fixed and mobile broadband resources and evolution of great quality. Health personnel will have access to a database from any internet-connected device at any moment, regardless of the operational system used. This way, the information and synchronization flow will be delivered automatically, in real time, from all levels of care and nodes of a network, eliminating critical steps of data transfer, delivery and consolidation, allowing and promoting the access of mother and newborn to a top-level care during pregnancy, labor and birth. SIP+ also offers new and more dynamic procedures for information and communication technologies directors and web administrators, providing permanent technical support and updates from one unique site for all users. The new SIP+ generates a dynamic data circuit, allowing interconnectedness in real time with other software programs used by a country, avoiding the duplication of tasks, making all procedures much more efficient. We cannot talk about health without information, and starting now, there are no more excuses for not making that happen. Here we have a tool with access to trustworthy information in real time. We leave in your hands the responsibility for making the commitment for the well-being of women and children of our region. This is SIP+. It belongs to the countries, with permanent support, and it is freely available. There are many challenges. The best is yet to come.